We are about to complete a wound dressing. I have reviewed the patient's chart, taken a look at his orders. I have administered pain medications 30 minutes ago so that the patient can be comfortable with this wound dressing change. Also, I have introduced myself to him, so he's expecting us to begin this wound change right now. I'm about to sanitize my hands. I will put on clean gloves so I can inspect the patient's wound. First of all, I will inspect his wound. I will remove the old wound dressing. This is the wound. We're going to remove the old wound dressing. And we're going to dispose of this in the trash right here. I will sanitize my hand again. And I'm going to create a sterile field so we can begin cleaning the wound. I have saline solution and it's not expired. And I have my wound care dressing. It's intact, not expired, and ready for use. Okay. I will put my wound here, I guess. Yep. I will open. Remove my sterile gloves. My sterile gloves. And I'm going to, in this sterile container, here is my blue sheet with the shiny pad down on the table. Here's my wound. I would now proceed to empty the contents onto the field. There you go. I will don sterile gloves right now. Okay, being careful not to cross my sterile field. What I would like to do is to there you go, to lip some of this saline solution into the trash, and then I will add some saline solution into my container. I would also add 3 pieces of gauze to soak so I could use it to clean the wound. Okay, there you go, 3 pieces of gauze right there. Now, what I would like to do is to proceed. This is my wound, so I think I should bring this right here. Okay, I will use my forceps. I will get rid of the excess saline solution in the gauze, and I will clean the inside of the wound. 1, discard it. Squeeze the excess saline solution. Discard the 3rd piece. Squeeze the excess saline. Clean inside the wound. Discard. This will go into the sharps container. What I will do next is to clean the outside of the wound. I would use these 3 alcohol sticks. I will open the pack, remove the first one. It would look a little bit like the cotton tip applicator, and I will clean the outside. I will get rid of that applicator. I will take another alcohol swab from this pack, clean the outside, discard of it. And for the third time, I will take the alcohol swab from here, clean the outside of the wound, and discard of it in the trash. Now the wound is clean, it's time to pack the wound. I would use a clean cotton tip applicator, and I will, with gauze, extend the gauze, whoops, like so, and attempt to pack the wound. Wait a minute, am I supposed to sanitize my hand again after I cleaned the wound? I hope I did that, and then proceeded to continue with packing. Alright, well, here we go. Always want to keep everything sterile and sanitized, okay? I'm packing the wound. Another piece of gauze. You don't want to pack the wound too tightly, but it needs to be sufficiently packed. Okay, so now my wound is packed sufficiently, and I will cover it with a piece of gauze. I will cover. And I will also take my padding with the blue strip on the top, laid over my wound, and I will secure the wound and this padding with tape on all 4 sides, okay? On the last piece, I would make sure that I have written my initials, the date and the time, secured over the padding over the wound dressing. At this time, I would make sure that I will discard of all that was used, goes into the trash. I would remove my gloves. And I will properly clean this workstation. I would also document in the chart my findings, the patient's ability to tolerate the wound dressing, his pain levels, and whatever comments that he had made, or all of the findings that I have found today. And that would be the end of the wound dressing session. Thank you.